Now we'll talk about another imaging modality, and this is what is called an intravenous urography. Now, if actually challenged with a word like this, I actually try to define terminologies. When you say intral is inside, venous is inside the vein. Okay, anything urology, urine, you are dealing with what? The urinary system. Okay, so from there at least I'll have an idea. So it's a diagnostic imaging procedure. It's used to evaluate the kidneys. I see in it now. So you can see in this picture right here, all right, this picture right down here, you see the kidney, you see the ureters, the bladder, and they use x-rays for that. Okay, so it's a contrast dye. The contrast dye is actually injected, all right, into your vein. So the contrast that, every blood actually passes through the kidney and all of that, so the contrast will get deposited in the tissues of the kidney. So when you image the kidney, it's much more clearer. Okay, so it's also known as intravenous pyelography or excretory urography. It's a radiographic technique that will visualize the urinary tract. So they do that by injecting the contrast into a vein. Okay, and the x-rays will actually track the dye as it passes through the kidney, the ureters, and the bladder, making them clearer. Okay, if you look at the image, do you appreciate this? Alright, so it's very beautiful. So what are the conditions that will make them want to actually do this intravenous urography for you? If you are passing blood in urine, if you have a urinary tract obstruction, if you have congenital anomalies of the urinary tract, if you have urinary tract infections and they are treating and is always coming back, if there's trauma to the urinary system, okay, there's sometimes pre-operative assessment. They just want to assess you before an operation and look at what is actually wrong with your urinary tract better before they go into the operation room. They can do an intravenous urography. The preparation and procedure is that before the test, patient may be asked to fast, undergo bowel cleansings to actually improve image clarity. A contrast dye is now given, through the veins, like I showed you guys in that picture. Then x-rays, they allow for like 30 to 60 minutes, okay, for the dye to actually go around. Then at least by that time it has gone around, it's now to the kidney. Then you basically do the imaging.